I'm Dr. Jane Simington. I have a background in both nursing and psychology. I specialize in the areas of grief, trauma, and suicide intervention. I'm an author, I'm a researcher, and I'm an educator. Today I'm talking to you about the Suicide Intervention Certification Training. A training program that allows you to become a certified suicide intervention counselor. This program is accredited with the Canadian Council of Professional Certifications. It's an accredited program. So it allows you to become certified as a suicide intervention counselor. And that certification is global. The suicide intervention training also allows you 52 continuing education units towards certification and recertification as an addictions counselor. And that's important because many people are suicidal following a life filled with trauma and horror. And they then use substances to try to numb the pain. And so because of that, for you to understand and know something about addictions, the use of drugs and alcohol is also an important component of this training, but also allowing you to receive those credits towards certification as a drug and addictions counselor is a valuable portion, an addition, a gift actually that you receive as part of taking the Suicide Intervention Certification Training. So I'll tell you a bit about this training that we offer regularly in the St. Albert area, in our center there. Also offered frequently in the communities. This program can be offered locally, nationally, and internationally on site, as well as online. Our online training now is available. I encourage you to look at one of these options for taking the Suicide Intervention Certification Training if you are working with those who are at risk. During this training, which is 5 units in length, we begin by looking at some of the facts and the myths regarding suicide. So you learn the correct language, but you also learn the facts and the myths so that you can use the information knowledgeably. Not all the myths about suicide are factual. And I will give you the skills to work with the facts and help people understand that some of the information they have is not factual, is not based in fact or theory. We will look at the social, cultural factors that may contribute to suicide. We will look at historical and intergenerational factors that contribute or can contribute. And I will give you the skills to be able to lessen those factors and actually heal some of those and remove some of those factors. We will look at family factors. We will look at things like genetic causes. We will look at factors like domestic violence, physical emotional, mental, and sexual abuse, and how that can lead to factors of powerlessness and hopelessness, and how it can lead to feelings of depression. We will look at depression. I will help you assess for depression, because we now know that depression is the leading cause of suicide. And many people working in the area of trauma and grief, hopelessness and powerlessness, and in the entire area of mental health, do not know how to assess properly for the symptoms of depression. During the suicide intervention certification training, you will gain the skills to increase feelings of hope, to help the person reclaim a sense of personal power, and to decrease feelings of depression. You will learn how to work with those who are feeling pressured by their peers, such as during times of bullying, either through social media or direct interaction. And you will help the person there learn how to manage that type of manipulation. You will learn how to assess for immediate risk factors, how to do crisis intervention, how to counsel during those times, so that you not only hear the pain, but that you actually help that person take steps forward in reclaiming their life and getting their life working. Not only working, but moving forward in a much more successful way. And so we also have a unit on helping those who are bereaved as a result of suicide. That's a particular type of grief known as complicated grief. In that unit, you learn how to work with the stigma and the shame so deeply associated with the complicated grief. We also have a unit on self-care. It's essential that those who work in these difficult areas, not only with those who are at risk, but also those who are bereaved following the death by suicide. It is essential that those therapists, those counselors, those helpers know how to care for themselves so that they are not re-victimized themselves and vicariously traumatized by the stories that they must help the person move through and resolve. I'm excited to work with you in your achievement of this goal to become a certified suicide intervention counselor